Welcome back. We speak to Dr. Nomafrench Mbombo, the Western Cape Health MEC, who says the province is the current epicenter of the COVID-19 third wave. Both public and private hospitals are filling up as fast as infections continue peaking. On Friday, the province recorded the highest number of new cases, with more than 3,900 people testing positive. MEC joins us now. Dr. Mbombo, a very good evening to you, and thank you so much for speaking to us. So let's just first start with a sense of your critical care for the past 2 weeks. What has it looked like?
For the past week, actually the numbers are decreasing. So from the hospitalization, from the case numbers, and also even the positivity rate and the reproduction rate. So we've seen a decrease. However, we shouldn't get excited about that, because we are coming from the long weekend, which is last week, of which is normally the numbers, you get them a week or so later. So we'll see how it's going to happen now, in as much as that we still have got about 2,600 average of the new cases. But noting, we don't test everybody. But what is crucial is about what is the positivity rate, which we have seen now. It is, because it used to be about 40+%, but now we're around about 37%. Similar also with because they are saying now that previously we used to say that we are about 24% to 30% in regard to be able to know whether we have reached the plateau or not. At least now things are coming down, but we mustn't be prematurely being excited about that until we get the numbers coming from the long weekend.
So just in terms of that, cumulatively, the numbers, have they surpassed those experienced at the peak of the second wave, and which areas are worst affected?
Yes, they've already peaked, because the second wave, I think, was on the 3rd of January. The first wave, I think, was on the 30th of June. On the 4th of August, we had about 3,200 something plus cases in total in terms of the admission, the hospitalization. But those numbers are decreasing. But as I'm saying that, once after the long weekend, there might be as many cases that are coming up, but there might not be early hospitalization, because normally people get hospitalized a week or so later. However, in regard to the bed occupancy and utilization, we're still about 70 to 80 general beds, noting we added the beds for the third wave, because lessons learned from the second wave, it was about let's add more beds. Of course, the critical care beds, there will always be challenges around that, but noting people don't have to go to ICU. They could be put on the high care with a high flow nasal flow oxygen.
What I want to understand is, are there areas that are worse off? I'm thinking of the Garden Route, for instance. In the second wave, it certainly was badly affected.
At the beginning of the wave, yes, it was affected, noting it's nearer to Sarah Batman and Gqeberha, where in the Eastern Cape, where they were the first to be on the third wave. Noting Western Cape, I think was the fifth to be on the third wave. Already parts of the Eastern Cape, like Gqeberha, were on the third wave, which is, you can understand the end to Garden Route. Currently, in the metro, of course, the metro, because of the high numbers in terms of the population, you will have higher numbers. And then within the metro has got 8 sub-districts. You get higher numbers in the northern Tygerberg area. Khayelitsha has always had lowest numbers, even in the second wave. It was only in the first wave where we had seen quite high numbers, in as much as that there's been increase throughout. But in all the districts, rural and also in the metro, the numbers have plateaued. But again, because we still have to wait for the numbers coming from the a long weekend, we should wait and see.
Okay. And what about daily oxygen requirements? Do they meet the capacity of demand?
In the second wave, let me tell you, during the second wave, things were really hectic. There was a time, I think, during the Christmas Eve, where we had about 24 hours to 72 hours oxygen left during that time for hospitalization, where you have to ensure that we meet. It's not only for the public hospitals, by the way, even the private hospitals, where we even have to meet with the CEOs of the AFROS, because it's the one that was nationally tendered to render oxygen for the whole of the public hospitals. So the lessons learned from the second wave, it has taught us that not to rely only on one form of source or what they are telling us. Because at the time, there used to be a truck that used to be coming from Joburg, which could take about 2 days to reach us. And there was only one truck, which is a smaller one that used to come from the from the PE during that time, because most of the oxygen used to be from the Mpumalanga, but all the coastal areas had challenges with the oxygen. So it made us to have lessons learned in regard to be prepared, having always extra in regard to that aspect. I think for the third wave, it just came at a time where we know exactly what we're dealing with.
But having said that, Dr. Mbombo, the modelling initially suggested that the province would peak by the middle of August. So do you feel that you are still on track, or are you preparing for a different scenario? As much as you say the figures are going down, you're also warning that we shouldn't be too excited. So there could possibly also be a lag in the test positivity rate numbers.
No, it's true. It's true. The model was initially, there was a time where we thought that it was end of July that we have peaked. And then we had some taxi violence, which resulted with most people having a high number of gatherings. And then the numbers shot up. And then it was also a suggestion that we are about almost, I think, 40-something chances that we have reached the peak, which is they keep on adjusting those numbers now and again. So this week, the chances that we might have reached the peak, it's about 24%. But again, it could be adjusted depending on such. Okay. So yes, indeed, it could be. It could be that we're plateaued because we have reached the peak, or it could be that we have plateaued because that there are still some numbers coming in.
All right. Thank you so much for speaking to us. Dr. Nomafrench Mbombo is the Western Cape Health MEC. And also,